Hey everybody, Misty Williams here from Healing Rosie, and we are going to have a really fun conversation today with Megan and one of the new doctors over at SteadyMD. So, if you have been part of the Healing Rosie community for any length of time, you know how challenging it can be to find a really great functional or naturopathic doctor to support you in your journey. And one of the things that the community as a whole, especially if you're in the Facebook group, the community as a whole has been really about over the last year is the option that they have partnering with SteadyMD. So I want to do two things because it's open enrollment right now, and I want you guys to be aware of some of the options that you have when it comes to managing your healthcare. Most importantly, you guys know that I'm all about advocating for yourself and really improving your quality of life and enrolling your doctor in that journey with you. And this is one of the reasons why I want you to know about SteadyMD, because for those of you who are having the experience in the place that you live where you're having a really hard time finding a doctor who wants to be your partner, this is another option for you. And if you've been in the community for a while, you've heard of SteadyMD, but Megan, I'm going to ask you just to jump in and update us a little bit. Tell us, what is SteadyMD and how is it different from, visiting a doctor locally, and how does it work?
Awesome. Hi, everyone. I just saw some of your comments, and it's really awesome to see that some of you are using SteadyMD and loving it. So I'd love to hear your experience with the platform. But SteadyMD is your personal doctor completely online. So instead of just finding a doctor that happens to be local, we actually pair you with a doctor based on your medical concerns, your lifestyle, the type of doctor that you're looking for. So specific to functional medicine or integrative medicine, which is really unique. So we have a quiz online where you answer a handful of questions and we pair you with a doctor that's right for you. Sorry, my dog is now in the background.
Special appearance today.
Hopefully she won't say hi in the background. Anyway, so I'm just like completely distracted. Anyway, so yeah, we pair you with a doctor that's right for you, which is very unique in my experience. We have doctors that are trained in functional medicine, and now we have a specific plan for those that are looking to dive deeper into their health. So we have an intensive functional medicine plan. It's like a monthly membership. Our individual plan and our functional medicine plan is like a monthly membership to like a gym. It's a flat monthly fee, and you get unlimited messaging, unlimited appointments, unlimited access to a doctor that's right for you. So it's really unique in that it's the sort of long-term relationship with the doctor that you kind of get to know and trust, and they get to know you. So we have all of your medical records in one place. They are kind of like the quarterback for your health, and they really get to know you, which is something that I found to be unique. And the fact that you can have that type of really deep knit relationship with the doctor. So that is what SteadyMD is. I talked a little bit about our functional medicine plan. It is $199 a month. Like I said, no copays on top of that, unlimited contact with your doctor. Our doctors can prescribe medications and have them sent to your local pharmacy. You can get labs and blood work done. And essentially how that works, because we're online, is they refer you to like a LabCorp or SonoraQuest, and you just get the blood work done. The results are sent back to them, and then you can review them together. So if you're specifically looking for a doctor that has training in functional medicine, we have several doctors that are right for you, but then we have Dr. Lyla here today, and she's amazing. So I'll introduce her a little bit. But first, do you want me to hit on anything else about SteadyMD?
I think that's a good start. We're going to actually do a webinar for you guys pretty soon so that you can come and ask all your questions and get lots of information. So more to come.
Awesome, thanks. So I'll introduce Dr. Lyla. She's awesome. She's going to talk to you guys today about all of your questions that you might have, but her training and background historically was in traditional medicine, and then she got trained in functional medicine in Cleveland, Ohio, and also knows integrative medicine. She can probably tell you a little bit more about her certifications, but she has, I don't want to say it wrong, but almost 20 years of clinical experience?
Yeah. Yep.
Okay, that's right. And so she's just a wealth of knowledge and really well spoken, and someone that I, trust any of her advice. So I wanted to connect you guys with her because she's such a great resource. And a functional medicine doctor at SteadyMD.
Awesome.
Thank you, Megan.
Thanks.
Well, welcome, Dr. Lyla.
Thank you. Thank you for having me.
Well, I was telling you a little bit before we got started about the Healing Rosie community. It's a unique place in this whole like ancestral health, functional medicine space when it comes to community. And I think it would be great for you just to share a little bit with us about your background, like what you obviously didn't start out in functional medicine. I'm sure there's some kind of interesting story on what drew you to the functional medicine space and had you study in this whole new program. I mean, it's like no joke to get trained in functional medicine.
No, it's not. And I'll tell you a little bit about that learning curve that I experienced. But my background was traditionally family medicine. I did a residency in family medicine after graduating from medical school back in 1997. And I did my residency right there in your current home state of Texas in Dallas at UT Southwestern, Parkland Hospital. That was a 3-year program. And I did private practice for about 3 years in the Dallas area before moving up to the Cleveland area. When I got here, my entire family moved for my spouse's job at the time. I continued to do traditional family practice. I did a little bit of urgent care as part of my practice, and I also did a continuity family practice. And then I joined a residency training program where I was faculty. And while I was there, I decided I wanted to do my master's in public health, and I also did a NIH-funded research fellowship in cancer control training. So I got a lot of different experiences while I was teaching as faculty. But probably about 2013 or so, I wasn't unhappy doing traditional family medicine. I loved the aspects of teaching and doing some research, and also the clinical patient care that I had as part of my career. But I was being pulled in the direction of integrative medicine because a really dear friend of mine named Tanya Edwards, who was a physician, also prior faculty at University Hospitals, Case Western Reserve University, had started an integrative department over at the Cleveland Clinics. And she asked me to come join her. She was, one of her docs was moving over to the West Coast, and she needed some help. And so she recruited me over, and I did some coursework in integrative medicine. But what I also started doing was attending functional medicine meetings. And these are didactic meetings, almost what we call drinking from the fire hose type meetings, where you're learning a lot in a week's time. Sometimes it's over a 3 or 4 day period of time. And so I went through all of the Institute of Functional Medicine's what they call modules. And about 3 years into that, it made more sense to move to a strictly functional medicine practice, because that's what the bulk of my training had been in over that past 3 years. And it just so happened that Mark Hyman and Patrick Hanaway had opened the Center for Functional Medicine at the Cleveland Clinic. And so I moved over to that department, still staying with Cleveland Clinic, the hospital, but in a completely different department. And it was nice to be able to integrate both some of the tenets of integrative medicine and that approach, a holistic approach to the patient, using modalities like chiropractic care and holistic psychotherapy and acupuncture, but then bring in the scientific piece, the other scientific pieces of, biochemistry. These were things, when I talk about a learning curve, this was like going back to medical school. And I always tell people I've learned more since 2013 to now than I learned in the prior 13 years, I think. Mm-hmm. And so I'm constantly being challenged to read, find out what's going on, because, there's probably a little less clinical research going on in the areas of integrative and functional medicine, because there's not necessarily a pharmaceutical agent involved.
That's right.
And pharmaceutical companies make money by marketing their drugs. But if there's no drug to be made at the end of the day, there's not going to be a whole lot of money invested. So a lot of the trials that exist for the things that I do and the things that my colleagues do, we're not getting a huge clinical long-term randomized control trial to look at outcomes. And so we do use a fair amount of, I don't want to call it trial and error, but anecdotal evidence. And I've seen this over the past 3 to 6 years in my patients, what's been helpful for a lot of people and what hasn't been. And there's a lot of leaders in the field that I continue to follow. And And it's an exciting day to be a patient right now because there's a lot of options.
Yeah. And there's a lot of options, certainly, if people realize that they actually have these options. And one of the things that I'm constantly encouraging women to do, in fact, there was a post I was actually looking over. I have my Facebook right here, if you guys see to the side. But I was just looking at a post from someone talking about she's just felt for years like, or, you know, her energy is not where it needs to be, and her doctor just refuses to do anything about it. And she feels stuck, and she's like, you know, I'm not showing up for my kids. You know, it's really affecting the way that I'm showing up as a mother. And I'm sure for her, it's affecting the way she's showing up as a wife if she's married, and it's affecting how she's showing up for work. And my response to something like that is, you need to find another doctor. But that's not a popular mainstream perspective on how you relate to a doctor as a patient. You know, we're kind of taught to give our power away, to say, you know, whatever the doctor tells us is what we do. And if the doctor doesn't want to do something, you know, it's kind of like your mom telling you that you need to go do the dishes, right? Like, I don't want to do it, but mom said, so I have to do it. And that's actually not how it is. As a patient, we do have the power. I want to say that word. We have the
agency.
The agency, right, to go choose something different for ourselves, you know? So if you're finding yourself in a position where, you know, your health isn't where it should be, you know, your quality of life isn't what it could be, I just want to invite you to consider the possibility of working with SteadyMD or working with a different local doctor in your own community. I've got lots of tips, and you can find them in the Facebook group if you just want to do a little searching on how to find a different kind of doctor to work with. So tell us a little bit, Dr. Lyla, about maybe some of the patients that you've worked with and some of the clinical wins that you've gotten for patients in this functional paradigm that you maybe weren't able to get for them when you were in a more integrative or traditional, conventional medicine paradigm.
Okay. Well, I would say by and large, probably the biggest chunk of patient improvement that I've seen have come from really honing in on patients' nutritional status. Believe it or not, you know, your nutritional status has to be the foundation of your health. And we look at food as medicine. And if that isn't right, we can't build upon that. So what we try to do first is get patients' diet in order. And sometimes it depends on where the patient's coming in at. Some people come in, most of the patients I see already have an idea about this. And so many of them are already on what we would call a clean diet. Some might be following a paleo diet. Some might be, you know, gluten-free or dairy-free. Many have already done elimination diets to find out if there's any food sensitivities. But depending on where your baseline is, you know, if you've got a terrible diet, then you can expect a whole lot of improvement just from changing some dietary habits. And so cleaning up a person's diet and then working on what's going on in their gut. So are they having a lot of symptoms of bloating? Are they having this alternating diarrhea and constipation, which people have come to term, you know, irritable bowel? You know, okay, irritable bowel syndrome, yes, it's a thing, but it's not a condition that you can't change without medication in many cases.
Right.
And so we get people going to the bathroom normally, you know, if they're constipated, we try to get them going on a regular basis every day. I say, take the trash out after every meal. That's my motto. If you move your bowels after every meal, things are going to be much better. And if on the other hand, you have a lot of loose stools, then we want to figure out what's going on. So we can do all kinds of stool testing. And I would say, if I had to cut my patients into buckets, probably the biggest bucket of people that have seen improvement were people that we improved their diet, they improved their diet because they're the ones doing all the hard work, and B, we got them going to the bathroom. That's huge right there. And I would say probably, if I had to estimate, 60 to 80% of people when they first come to see me have something in those two buckets that I could improve right away. So cleaning up somebody's gut and putting them on a gut regimen can really get the ball rolling to better health. And sometimes I don't have to do anything other than that. Yeah. You know, we'll do some other testing. You mentioned thyroid. We'll look at thyroid studies because a thyroid that's not functioning optimally can result in a lot of different really kind of vague symptoms that might not necessarily point to a thyroid problem. But if you uncover it and treat it, then sometimes their issues will improve drastically.
Right. Well, this is awesome. I'm so excited to meet you. I'm really excited to set up a Q&A. We've done these before in the Healing Rosie community where I invite everyone to ask their questions.
Okay.
So we'll tee that up and invite you back to just do an awesome Q&A with everyone. And so you have a health or a challenge that you're dealing with hormonally, thyroid, gut issue, energy issue,
Yeah.
and you would like to get Dr. Lyla's perspective or take on what you're dealing with and maybe get some advice, I would invite you to just drop your question below here in the status on the Facebook group. If you get this in the email that I'm going to send out to our entire community, you can just reply to the email and let me know what your question is, and we'll bring Dr. Lyla back to do a Q&A with everyone. But I hope if you are looking for some better solutions for your healthcare needs and are having trouble finding someone locally, that you will feel comfortable checking out SteadyMD. I've included the link for you. You can just go to healingrosie.com/SteadyMD. Anyone that comes through Healing Rosie, they kind of know what kind of doctors we're looking for in our community. So they're going to set you up with someone that is aligned with our values and the kinds of things that our women find important. So check it out. You can get more information, and we'll be sending out more information on SteadyMD soon. So thank you, Dr. Lyla, for joining us today. Thanks, Megan, for stopping in too and giving us just a little primer on the great news. I'm so excited that they've decided to expand functional medicine space because so many of us in this community need it. So thank you both for joining me today.
Thank you.
All right. We'll talk to you guys soon. Have a good one.
Bye.